Welcome to GenerationRx, Safe Medication Practices for Better Health. We're putting this on as part of the Caregiver Support Network webinar series. And I thank everyone that's here today. I thank the Caregiver webinar series, Caregiver Support Network. I will be providing links to that later. That is a partnership between Ohio State University's Extension Office, the Ohio Agribility, which is who I work for, as well as Extension at Ohio State, Ohio Department of Developmental Disabilities, the Ohio State College of Nursing has been part of the planning, so we appreciate all of that. Again, up on your screen right now, we have a pre-survey. If you could please take that, we would really appreciate it. It gives us the opportunity to see if Dr. Sloan and Dr. Schmuel are actually teaching all of you what we think. So it helps us to see what you've learned during it. So, and there will be a post survey at the end. Darn it, and I just clicked it. I'm going to paste it into the chat box in case you can't use that. If you are watching this later on, it should still work if you're watching it as a YouTube video. The link to the survey is in the chat box right now. So I'm Laura Ackerman. I run the Caregiver Support Network. We've had a number of webinars. We've looked at caregiver burnout. We've looked at respite. We had a really, really popular webinar in February about respite, which I think proved that a lot of people really needed a break after the year that we've had. Today, I am so excited to welcome Dr. Ruth Eptage and Dr. Kelsey Schmuel from the OSU College of Pharmacy. They're going to talk about the GenerationRx and safe medication practices for better health. If you have any questions during this, if you'd like to put questions in, if you look at your Zoom dashboard, that black bar that has some symbols and some writing on it, the Q&A is on there. You can just go in and type in a question and they'll be looking at those. Their colleague, Cynthia Sloan, our colleague, Cynthia Sloan, is also going to be helping. She's the prevention coordinator for one of the prevention coordinators for the Ohio Youth Resilience Collaborative, which is a group of the College of Public Health, College of Food, Agricultural and Environmental Sciences, Ohio State University Extension, and the College of Education, Health and Human Ecology, all at Ohio State. We're all working together. And Cynthia, how many is at least a dozen rural counties, probably more by now, with delivering substance misuse, education, and family programming and community programming. Good. So I'm going to turn it over to Ruth and Kelsey right now. And thank you. If you have any questions, remember to pop those in there. If you could take that survey, we would really appreciate it. And I think that's it. And we're recording. So if you could please go on and accept the recording, I'd appreciate that too. Thanks a lot.
All right, here on the transition over here, I zoomed past 2 slides. I backed it up. So you should be seeing, I'm hopeful, the title slide for Safe Medication Practices for Better Health. I'm just going to throw out a few more organization names here and then we'll get started. So GenerationRx is an initiative that started several years ago, and it is brought to you by not only OSU College of Pharmacy, but also with a partnership with the Cardinal Health Foundation. And we have both Dr. Kelsey Schmuel and Cynthia Sloan with us today too. They're really going to be helping to flag me down and make sure that we answer your questions either back in the question and answer directly, or to throw it back to me to kind of answer for the full audience. So I'm really thankful to have both of their help here today. So as we get started, certainly our idea or what we would like to get across today is a threefold message. And the first is for those of us who take medications or those of us who are caregivers and are giving medications to others, it's important that we become very knowledgeable about medications. Just like if you were headed out to buy a new car or a new lawnmower, I'm thinking a lot about mowing lawns these days. Mine keeps growing. You gather gather information about either the car or the lawnmower that you want to purchase before you go in and use it, right? And so the same is really true about medications for ourselves or about others that we're caring for. And that's kind of the be your own advocate. So we as consumers of medications are the most important member of our healthcare team. And that's very true for caregivers too. You play an incredibly important role in safe medication use. And then we'll transition over to talking more about general safe medication practices. And that's really going to focus on the safe storage and disposal of medications. And that really is because it ties so closely to knowing the risk of medication misuse. And so we'll kind of finish out our content with a bit of a discussion about, unfortunately, the prescription misuse epidemic that we have here in our country and what we all together can do about that. So without further ado, I'll continue on. So I'm very hopeful that, like myself, you have been able to experience some of the benefits that come from medications. But unfortunately, we know that sometimes side effects or undesirable effects can also happen with medications. And that's part of the reason why it's really important for all of us to become knowledgeable about the medications that we take or that we're facilitating others to take, so that we can do our best to help avoid some of those issues. And one thing that I want to throw out to you, and I should have prefaced, is we are going to do a few poll questions. And I think Laura is going to help me with the first one here. I would like to know if you happen to have any information, and I'm hoping you can see the poll question up there now, just how many prescriptions per year do you think are dispensed in the United States every year? So we'll give you just a few minutes to think about that. Looks like some of you are responding already. It is definitely over 500 million. I kind of gave you a hint there already. So, but let's see just what your thinking are on just how many prescriptions are dispensed in the United States every year. All right, I've given you 30 seconds. I think that's going to be about what we're going to go with. So the correct answer is 4 billion, and it's actually over 4 billion prescriptions that are dispensed in the United States per year. And, you know, my area of focus, and I should have led a little bit with that, is on medication use, specifically in older adults or in the geriatric population. That's where my specialized training as a pharmacist who is specialized in geriatrics comes from. And what we know is of those 4 billion, a large share of that, and it varies somewhere between 30 and 40% of that 40 billion is in individuals over 65 years. Certainly folks that you're caring for can be of a whole host of ages, but most of what we're going to talk about is applicable pretty specifically to older adults, but is useful to any caregiver. All right, and then moving on here, if I can get my slide to advance. Talking about be your own health advocate, as I mentioned, certainly those who take prescriptions and help others to take those prescriptions are the most important part of the healthcare team. Oftentimes it does take a team to adequately care for an individual who may have several chronic conditions or chronic health issues or acute issues, but it's really up to individuals taking or providing those medications to be the ones to become informed about those prescriptions. I'm going to give you just a few hints on how to do that from obviously a pharmacist's perspective. So one of the things that it's important to know about any medication that we're taking or giving is what really is the best time of day to take that medicine. Is it better for that one to be taken in the morning or in the afternoon? Is it okay to split or crush that tablet? And should I take that with food? Should I take it without food? What are some of the common side effects that we might expect with those medications? Or what should I do if I forget to give or take the dose of that medication? And so these are some of the things that it's important to become informed about with every prescription that you are that you're dealing with in a day. And of course, I'm going to tell you that one of the more accessible health professionals to ask these questions of is your community pharmacist. And you can either do that in a face-to-face conversation as picking up the prescriptions, whether that's a refill or a new prescription, but also your pharmacist is accessible via the telephone. And sometimes that is the way that most people are going to be talking with their pharmacist, and that they may be taking advantage of mail order part of an insurance program. So talking with the pharmacist to try to gain some of this knowledge about the medications is really, really important to do, to try to help get those beneficial effects from the medications, but at the same time, stay away from some of the issues that can happen and some of the side effects that can happen from the medications. And I'm not going to answer every one of these questions for you, because it's truly going to depend on what prescription or medication that we're talking about, what the appropriate answer to these would be. But I would say these are 5 questions that are really good to gather that information from before taking a medication. And then I am also an educator at the College of Pharmacy, and try to teach our Doctor of Pharmacy students what I feel is important for them to know about the care of older adults and their medications. And certainly one of what they would say my soapboxes are is how important it is for every individual to keep a complete medication record. And complete is important. So not only should this be prescription medications, this should also be any medication that doesn't need a prescription that someone's still taking. Here, an example here would be that Prilosec or that omeprazole, which is for heartburn or indigestion, sometimes referred to as PPIs. And then any pain relievers or any vitamins or herbal supplements, all of these things are important to keep on the complete medication record. And one of the things after the seminar that we'll be sure that is posted on the Caregiver Network site there is a blank link to this medication record that is part of our GenerationRx information, and is also available to you if you would like to go directly to generationrx.org. That's .org. So before I move on from here, as far as that complete medication record goes, the important things to keep on here is certainly the name, and it's best if it is currently going by a brand name to also have that generic name listed, and that information is pretty readily available to any of you. And then as far as the direction column, I really encourage people to put specifically what time of day that they're taking the medication. And the reason for that is because this is a communication tool. So at any time that someone is transitioning between a home setting to a inpatient stay or to a rehab facility or a skilled facility, then this information on what time of day they were taking it is also available to the new team who is helping to take care of that individual and their medications. And then a general use. So unfortunately, or maybe fortunately, I guess, medications can have multiple different uses. And so to define what that specific individual is using it for is also important to put on this medication record. The prescriber, so who is it that wrote that prescription, if indeed it is a prescription medicine, is also important to keep on this list. So if someone needs to get a hold of that prescriber, then they know exactly who it was who dispensed that. And then you'll see on the medication record that we put forward as a template for people to use, other more general information about a medication is also good to keep in there. So the example on the top line here is lisinopril. It's a really common blood pressure medication, but one of the things that it can do because of how it works in the body is in some people, it can increase potassium. So for us pharmacists and health professionals, that's important because we know we need to monitor that through blood work. But for those people who are taking it, it's important to know that salt substitutes are often high in potassium. And so it's probably not a great idea for someone taking the blood pressure medicine lisinopril to take the salt substitute that has a higher potassium in it. And again, that's some information that it's good to get in advance about a medication that you or that someone you're giving medications to should know. And your pharmacist, again, is a great resource for that. And that kind of goes on to, so what are some of those things that the pharmacist can be a resource for you too? And that would be helping to provide that information for those 5 questions that I led with, as well as the blanks in that medication record that are important to document and keep down for yourself or for someone that you're caring for. And then, as specific questions come up about a medication, if you're worried that you or someone else you're caring for may be having an adverse reaction to a medication, your pharmacist can be a good resource. If it's a significant reaction, obviously we want you to reach out to the physician or call 911 if necessary. But for some of that day-to-day information and collecting that knowledge to be knowledgeable about the medications, your community pharmacist can be an awesome resource for you. And I'm going to pose a question, but I'm going to answer it myself. Do any of you know how long, at least at Ohio State, it takes for someone to get their doctor of pharmacy license, which is the entry-level license for a pharmacist? I'll give you a minute to think about it. So currently at Ohio State, I didn't give you a full minute. Currently at Ohio State, it's either 7 or 8 years post high school. So most of our doctor of pharmacy students come to the College of Pharmacy already with an undergraduate degree, usually in some related science field. And then they're doing an additional 4 years of the professional program before they're eligible to sit for the license exam for the pharmacist. So I only share that with you to let you know that we as pharmacists are pretty knowledgeable, and we tend to call ourselves the medication experts. You can decide if that's an okay label for us or not, but we tend to look at ourselves in that way because of our specific training on medication use and how we're to monitor those medications and how to come alongside folks to help them get those benefits from the medications while also avoiding any of the potential issues that might happen with them, or at least catch them early if they are occurring. Okay, so another source besides your community pharmacist for information is actually right before you on all those wonderful amber bottles of prescriptions. So the prescription label does have oftentimes a decent amount of information on it. And right now, what I want you to do is just kind of look through this prescription label real quick, and then I'm going to, here in just a moment, have Laura do one more poll question for you, but I'll give you a second first to look at the label. All right, Laura, if you'll pop that other poll question up there, the second one. So given the label that you see here, which it says the drug happens to be metformin and it's 500 milligrams and they're tablets, and the directions are to take 1 tablet twice daily. So what I'd like to know from you is, what exactly do you think that means, or what is the best way to take this specific medications with the knowledge that you have at this moment in time? All right, we're getting some responses already here. I'm going to give you about 5 more seconds to see what you think. All right. I tell you, time goes by fast when you got those polls up there. So I see that we had A, B, and D responses. And really, probably the most appropriate is A. And part of the reason for that is the other information on that label was that you should take it with food. So then it just makes sense to take it in the morning and the evening. Metformin also happens to be a medication used for helping to keep blood sugars under control for those people with type 2 diabetes. And so it is also important to take those with meals. Spaced 12 hours apart probably wouldn't be the best way with the metformin here. Certainly if you space them 12 minutes apart, that you certainly could take it with a snack or whatnot, but really for this specific medicine, it's best to take it with food and to take it kind of that morning and that evening meal, as long as they're spaced somewhere around 8 hours apart. So that's probably more information most of you needed to know about metformin. But again, the prescription label can give you some information, and sometimes it gives you information to help prompt you to other questions that you then should seek out your pharmacist or others to find the answers to. So thank you for participating in that. I appreciate it. I think I'm finally figuring out if I click over on that poll and then click over here, I gotta hit the button twice. All right. So then also what we have here is another label. And this is the label that most of you have probably seen on the non-prescription medications that are available for us to use. This happens to be Tylenol or acetaminophen extra strength drug facts label. And these do, by the FDA, have to have specific information on them. And oftentimes there's a whole host of information on here. I will admit, and I imagine many of you can relate to the fact that sometimes I think it takes a magnifying glass along with the label to be able to get to that good information on the drug facts labels, but there's all kinds of things that are here. So it's going to tell you specifically what the active ingredient is in that product. And what I found several years ago was that medications that are labeled Tylenol don't always have just acetaminophen in them. And actually, sometimes they don't have acetaminophen in them at all. So the first place and the most important place to flip to on that drug facts label is, what are all the active ingredients in there? Most of the time with those non-prescription medicines or the OTC, over-the-counter medicines, those are synonymous terms, they're going to have more than one active ingredient in them, especially when we're talking about cold and flu products. So it's important that you are choosing wisely the products that you're using or getting that are non-prescription. And again, I would refer you to the pharmacist that should be right there available to you in the pharmacy to help answer the question as to whether this specific product would be applicable or useful for the specific symptoms or reason that you're grabbing for that medication. And then the other thing that's really important if someone is taking a non-prescription medicine on a routine basis is that that gets put onto that complete medication record so that the information can then go and be transferred into the electronic medical records so that everyone is informed about all the medications that someone is taking. So there's a whole host of things that you can find on this drug facts label, and it is important to try to gather that information. So, and this kind of leads up to probably what you thought were likely coming next, is that any medication or really anything that we take internally or by mouth can impact our medication therapy. So this includes the foods that we eat, anything, other substances that we drink, whether that's alcohol or non-alcohol, those other prescriptions, non-prescription medicines, any herbal products, any vitamins, all of these things do have the potential to interact with one another. And one real specific kind of interaction that I often think is a good example is of a prescription and a non-prescription medication. And one of a fairly common used medication, warfarin, which is a blood thinner, can have a somewhat significant interaction with some of the non-prescription pain relievers, such as ibuprofen or naproxen, and those brand names would be Aleve or Advil. And so it's important, again, for everyone to know that complete list of medications that an individual is using to try to stay away from some of the side effects and drug interactions that can occur with medications. And it's not only between prescriptions and non-prescription medicines. Sometimes I feel like many of the interactions that I am finding and trying to help individuals work around are between prescriptions and vitamins. So there are sometimes fairly significant interactions that can happen. An example would be a thyroid medication like Synthroid or levothyroxine. That's the brand and generic name. It's really important not to take that with iron or with calcium, as it can keep that levothyroxine or that calcium from getting fully absorbed into the system and can change the blood level and effectiveness of that medication. So that's just one example, but it hopefully drives home the importance of asking questions and becoming knowledgeable about either your own or the individual that you're caring for their complete list of everything that they're taking to try to stay away from running into issues with medications. So, and then, you know, I've talked a lot already about trying to avoid those side effects or those adverse effects that can happen with medications. But regardless of how good we are, they can happen. They've happened to me before. So what is it that we should know if an individual we're caring for or we ourselves start to have a symptom or a new issue with our health? What should we do? So one thing to ask yourself is, did this start after doing something different with the medication? And that could mean that you added on a medicine, that the dose of the medicine increased, many different changes, or is it just that the individual has been on the medication for long enough that we're starting to see a potential issue with that? So if you suspect that a side effect from a medication is occurring, it's important if it is a bleeding or a breathing issue, it's easy. That's severe. That's a call to 911 to get emergent help. Otherwise, if it is a headache, if it is stomach upset, if it is a rash, these are things that you can call your doctor or your pharmacist to get their expert advice on what it is that should happen next. But if you suspect, or someone you're caring for suspects that they're having an issue from a medication, it is important to act upon that and seek out professional help to try to determine if indeed that is the case. I know that we in the College of Pharmacy at Ohio State really try to train our student pharmacists to, if a patient that they're caring for, if they start to have a new symptom or a new health problem, we're trained to automatically go to that list of medications and really evaluate, do we know, with the knowledge that we've gathered, do we know if any of these might potentially be leading to, or at least contributing to, this new side effect or symptom? So I just encourage you to act upon and to seek out expert advice if indeed you feel like a new symptom or health issue could be from a medication. That is kind of finishes up that first part, which is equipping us to be our own advocates and become knowledgeable about the medications that we take. And that includes prescription medications, non-prescriptions, all of the things that we consider medications, those herbals and those vitamins. Now I'm going to transition a little bit more into some of the practical things that it's good to know about safe storage and disposal of medications. So one of the first safe medication use practices that we like to make sure we're educating others about is that it is important to use prescription medicines only as directed by the health professional. So what we've learned over time is sometimes more isn't always better. So if you or someone you're helping is getting a good response, but maybe not quite as much response as you want, it's really not okay to double up on that dose without checking in to make sure that the health professional feels that that's an adequate next step to get to where you want to be. We just want to make sure that there's open communication on any changes that might happen with especially those prescription medications. So it's just good to keep up that dialogue. It may very well be that a dose increase is exactly what is needed, but we need to have documentation of that and give and take about efficacy and potential for side effects with any of those dose changes. That also goes with a decision to stop a medication too. It's just best practice and best safe practice to have open communication with the health professionals about those types of decisions. And another example that I'll talk through here, a real specific one, has to do with antibiotics. So it is really important for continued efficacy and benefits from antibiotics that we take them for the full amount of time that they are prescribed. So unless you're having a significant side effect from them, of course, that's a different conversation. But once you start an antibiotic for an issue, it is best practice to finish out that full course of antibiotics. And that's because those silly bugs can get resistant to them. And sometimes if we stop short of that full course, that can happen more frequently. So those antibiotics specifically, it's important to take that full course of antibiotics. Another important point is certainly not to share or to take someone else's prescription medication specifically. And this is just because, you know, our individual bodies and those choices to prescribe a medication by a prescriber are for one specific individual based on their health circumstances and based on the other medications that they're taking. So not to share or to take someone else's medication is really the safest practice. And unfortunately, this does happen and can lead to some significant issues and some significant side effects with medications. And the third point here under safe medication practices is to make sure that you are safely storing medications. And really the safe storage of medications is best to use that in a secure lockbox if at all possible. And this just really helps to keep those medications safe, certainly from young hands, but also from falling into hands of those who may want to take them for not the purposes intended. So to lock those up in lockable spaces, if at all possible, is really the best practice. And certainly to avoid keeping them indoors in drawers that are low enough for young folks to be able to access those medications. But I'll tell you one place that it's just plain not good for the medicines themselves to store are in those medicine cabinets in the bathroom. And the reason for that is that that is probably the most humid environment a few times during the day when someone is using the shower or the bath. And that humidity is just not good for those medications. So the medication cabinet is actually not a great place to keep medicines. We need to come up with a better term for those medicine cabinets. So maybe we should call them the deodorant cabinets or something else. So, but the medicines should really not be stored in the bathroom. And a locked cabinet is the best place to put them. And then we're going to move on to safe medication disposal. And really the goal here, again, is to try to help with the medication misuse issue that we have here in our country. And that's because prescription medicines that are no longer being used are falling into the hands of those who are not wanting to take them for the intended purpose, but for the effects that they might give to an individual for which it was not originally intended. So one of the best ways that we advocate for safe disposal is to seek out a drug box. And you're right, this looks a lot like a mailbox. Don't put them in the US Postal Service mailboxes. That's not what we're talking about here. The prescription drug drop boxes actually look a little different, and they'll say that right on them and can be found at police stations and sometimes fire stations as well. And we're going to give you some resources here at which to go and look up that information specifically for you. And then also the second option is for a drug take back event. And these happen usually semi-annually and are sponsored by the FDA and usually community partners. They often are happening in April and October, but people need to dispose safely of medications in other months of the year as well. So these drug boxes are a great way to do that. But I'm going to give you just a few other resources here. So if there's no drug drop box or there's not a take back event, it's not April and it's not October, or there's not another community event happening in your area, the third option, and it is your third option, is to dump the pills out into undesirable contents. And we often use the examples of kitty litter and coffee grounds because the pills and the tablets will just get mixed in with all of that. and then you can safely put those in your normal trash. But definitely take the label off of those prescription medications to separate the personal health information from that actual vial, and then shred it and you dispose of that just like you do with other personal health information. So this is the third option, but a good option too. There are other things that can be purchased that are medication disposal pouches. You may find them at the pharmacy. You can certainly find them online, but one additional resource, and again, if any of you are tuning in from outside of Ohio, I'm afraid this one's not available to you, but for those of you who are from the wonderful state of Ohio, it is available to you, and that is OhioRxDisposal.com. And what you'll find here in Ohio is you can actually find a disposal location nearest to you, but you can also request, and it's free, a disposal pouch to be mailed to you. This is sponsored through another program that we've been able to partner with at the College of Pharmacy. So OhioRxDisposal.com, I encourage you from Ohio to look at that for another option for safe medication disposal. And if you are not from Ohio, the FDA website is going to be your best place to go to try to locate either take-back days that are scheduled or to get to specific sites in your area that will have these drug take-back boxes. All right, and then the fourth kind of point to safe medication practices is for all of us to do our part to model those safe medication practices. So it's great to be knowledgeable about what we should do, but it doesn't do any of us any good if we don't do it. So if we're not locking up our medicines, if we're not safely disposing when a medication expires or is no longer being used, then we're falling just a tiny bit short. So I encourage you to follow through to step number 4, which is to model those safe medication practices and to share them widely with others for which it could be useful information. All right, now we're going to get to kind of the last section, the last key message of what we would like to leave you with today, which is unfortunately to talk a little bit more about the prescription misuse issue we have here in our country and for you to know about the risks of medication misuse. So the definition of prescription drug misuse and medication misuse is really threefold. So I'm just going to give you a moment to kind of take in what this slide has here for you. All right, so prescription drug misuse can really fall into any one of these 3 different categories, okay? And one thing that I want, and Laura, I kind of shifted a little bit when I was going to have you do poll number 3, but if you'll go ahead and launch poll number 3 right now. Where do you think people who do misuse prescription drugs most commonly get them? What do you think? Where would they most commonly get them? Is it mail order pharmacies, off the street, family members or friends, physician office, sample supply? All right, I am going to end the polling because I think this message appears to have gotten across. So it is, unfortunately, it's family members or friends. And that's the reason that we kind of want to make sure that we're all knowledgeable about the fact that prescription drug misuse happens. And most of the time, oh, I should get this off of here. Sorry about that. Most of the time that is happening because they're getting them from families and friends. And so one of the ways that we can try to change prescription drug misuse is to store those and dispose of those. But it's also important to know that taking more medication than prescribed also is prescription drug misuse. Taking medications for a reason different than prescribed. So really looking for the other effects that a medicine may have. So say that with a stimulant medication and an individual, a college student is studying for exams, is taking a stimulant medication that is not prescribed for them to try to be able to stay up all night to study. Sharing or taking someone else's medications is also prescription misuse. And when we're talking about medications falling into the hands of those it wasn't originally intended, and those hands coming from family and friends, that's really for the misuse of those medications as well. So unfortunately, this epidemic is affecting all of us here, and drug overdose, unfortunately, is the leading cause of accidental death in our country. And most people who use heroin or other illicit drugs, unfortunately, where they probably originally got their start was from misusing prescription medications. So it is an issue that we all need to be aware of and to do our part to try to control the medications that are in our own possession, as well as to try to inform others of what they can do to try to impact and avoid this problem continuing to take hold in our country. So what is it exactly that we would like to see you do? We'd like to see you be informed about the medications that are being used, to discuss all medication issues with your doctor and your pharmacist, obviously to safely store and dispose of those medications, and also to join us in the efforts to spread the word about safe and appropriate medication use. Because I do think that if we do this together, each one of us doing our small part really can make a difference, not only for safe medication effects and avoiding side effects amongst ourselves and those that we're caring for, but also to try to have an impact with the prescription misuse epidemic that we do have here in our country, and to try to collectively together make an impact on that. So I just want to summarize and make sure that you feel empowered to become knowledgeable and to use your community pharmacist and the other health providers that you're interacting with in the care of your loved ones and yourselves, to become knowledgeable about the medications and to really maintain those complete medication records to use as a communication tool between health providers. Electronic medical records really are wonderful, but oftentimes they don't have those non-prescription medicines, and oftentimes they don't have the specific time of day that an individual has worked those medication into their everyday life. So that's kind of the be your own advocate summary. As far as the learning safe medication practices, it's not sharing those medications with others, taking them as prescribed, to store and dispose of those medications appropriately. And then the risk of medication misuse is really for you to know and keep at the forefront of your mind that unfortunately we do have a prescription misuse issue in our country that is contributing to a larger epidemic, and the parts that we can play to try to impact that. So with that, I do want to refer you back to GenerationRx.org as a great resource, not only for some of the content that we presented here today that came from the older adult toolkit, but the GenerationRx.org content that the College of Pharmacy, with partnership with Cardinal Health Foundation, has put together toolkits for various ages. So you may find yourself being able to educate a different age group about safe medication practices. And those resources are available free for you to download and to use widely. We just ask that you don't manipulate the content in any way and use them as they are intended from those different toolkits. So with that, I'm going to flip to the next slide, and that is our post-webinar survey. So hopefully most of you were able to easily access that. And Laura, if you wouldn't mind dropping that post-survey link into the chat, if that's an easier way for you to click on and get to that survey. The other way is, and I just figured this out about a month or so ago, is that you can literally take your smartphone, get on the camera app, point it at the QR code there, don't need a reader, and it's going to take you right to that Qualtrics survey, okay? If you're someone who really loves to do old school and you just want to type in the full link there, I just want you to point out between that V and that 6, there is a little underscore there so that you'd have to insert that to actually get to the Qualtrics survey. So I do want you to go ahead, and a lot of these questions are going to be similar to what you had at the beginning for us to get an idea, were we able to help leave you with some educational nuggets of what you knew when you came in to what you learned towards the end here. And then with that, I'm going to also, hopefully that gave you enough time to see the QR code. I want to turn it over for Cynthia and Kelsey to let me know, is there any other questions that we should be, maybe would be better here in the full group for me to talk about, or for either of you to talk about with the full audience?
Yeah, we had a couple questions in the chat. Thank you, Sandra, for your questions about skipping doses and what to do in the instance of skipping doses. I wanted to open it up to, Sandra also had a question about how we dose medications when someone's not able to swallow anymore, particularly in like end stage Alzheimer's. So I gave a couple answers in the chat, but if you wanted to answer yourself as well, Ruth, I think that would be great.
Absolutely. I think a great thing there is to seek out the information as to what pills can be crushed, but also it's pretty amazing how many medications actually come already in liquid form. And so if you find that the liquid form is easier for someone to do, for you to be able to give to someone with dementia, that's another alternative. And then some things can also be done through a patch. Not all medications, but there are some, and some of the memory medications actually do come in a patch form too. So explore with your pharmacist different dosage forms that might be useful for you, can be helpful. And then of course, I know my nursing colleagues are always good at teaching us how to crush up and put maybe an applesauce or a desirable substance to be able to get someone to take it more readily who may have some dementia, making it more difficult to take a medication. But yes, I agree. That's an excellent question for us to talk about in this forum.
Ruth, do you mind going over to the GenerationRx webpage and just showing people how many toolkits there are? I know some of the people on today are our extension educators, and they are very familiar with the toolkits. But in addition to this that you just did today for the older adults, I, for example, a couple of years ago was presenting at the Ohio Rural Health Conference. Mm-hmm. The day before I presented, I was in another session. They broke us into groups, and we were supposed to come up with some kind of a, what's kind of an easy lesson or a lesson that you could teach people, or some kind of a presentation. I said, well, you can just go to generationrx.org and download a presentation, and it's there. And I mean, it was like 30 seconds that I said that, didn't think anything of it. The next day during our presentation, which was on our opioids grants, and Brittany Sandage had come in to present and talk about our extension work, 2 or 3 different people said, by the way, I was in that session yesterday. You mentioned GenerationRx. My teenager needed something for 4-H, Junior League, whatever it was. And they've already downloaded the GenerationRx high school toolkit, and we love it. And I was like, it's that. And I have had one of those last second, oh, the presenter I lined up for this meeting is no longer available. Thank you, GenerationRx. It's there. It takes that much time. But I just wanted to share that with everybody, that the toolkits, do you mind opening the toolkit? They have them for all different groups, because obviously what we saw today would not hold the attention of an elementary schooler. But the elementary schooler one, it's totally appropriate for them. And you're never too young to learn.
Yeah, are you seeing it? Did it work? I tried
Yes,
to show it is working great.
Yes.
Can't always tell. So yes, just going up here, you can see generationrx.org. There's an elementary, a teen, a university, a more general adult. And then the content I took from was the older adult toolkit today. And that medication record template is in there as well. And then there's also a patient resource too. So there's a whole host. And let's see. I'll go ahead. I'm just going to open up the older adult one here, just so you can kind of see all that is in here. But any one of the toolkits, it's going to be similar, that you're going to have a getting started page that's going to give you some tips and tricks on presenting this content or where to go that might be most appropriate for this content. And then the presentation resources. So the slide deck that I used here today is going to be available to you there. There's also often some interactive activities. So one of the things with the older adult toolkit that kind of reviews some of the information that we went over today is a trivia game powered through a PowerPoint presentation, and a facilitator's guide is there too. There's that blank medication record there for you. And then also most of the toolkits are going to have other resources for you. And so Laura, I really greatly appreciate you directing me to pull this up, because one thing that I did want to leave with this audience is, if you're in a situation where you cannot necessarily get a hold of a health professional or your pharmacist, another option, and again, I would prefer it be the last option, would be the National Library of Medicine and National Institute of Health. So Medline Plus information does give some reputable, just basic information about prescriptions and non-prescription medications too. So I would encourage you to use that as a resource if you need it. So the website is www.nlm.nih.gov/Medline Plus /. So that's a good resource for general drug information. And there's some other ones here too. And then most of our toolkits are also available in Spanish as well. So I'll take you back, see if I can appropriately do this on the spot. All right, there we go. So those are back to some of the toolkits that are available via the GenerationRx information. But I do want to throw it back out there. Is there any other questions that has come to mind for any of the participants on the call that you would like for me to address? If you can just go ahead and put that in the Q&A or in the chat. And Cynthia or Kelsey, if you could make sure I see those or get those, that would be great.
There was a couple of questions in regards to missing medications and best times to catch up, or maybe even to consult their doctor to see, I guess, depending on what kind of medication it is. So
yeah, and that really, it is a very drug specific answer for that, really, to be real honest. And it's going to depend too, is that a medicine that you're giving is twice a day versus once a day, and what it's being taken for. Those are some of the factors that we'll take into consideration as we would give individual advice about that. So really, that's a great reason to pick up that phone and call your community pharmacist and ask that question. Say, hey, we missed the dose yesterday. What on earth should we do? Should we try to make this up, or do we just need to move on from this point? Oftentimes it is just moving on from this point forward, but it is an excellent question to ask. And really, I prefer that we ask that in advance, and that's something that we gather when an individual is first given a new prescription, to find out that information. Sometimes the pamphlet of information, again, get out that magnifying glass because that print is small, but sometimes it's in that information that comes with that prescription too. But your community pharmacist, you don't need a magnifying glass for them, so just ask them that question. And I did forget one thing that I try every single time to say, and that is, when you're going to the pharmacy to pick up a prescription, especially if it's a new prescription, they have to, by law, ask you if you want to talk to the pharmacist about the medication. And what I encourage everyone to do is to say yes. And it might take a minute or so for the pharmacist to get over to talk to you about that medicine. And if no specific question comes to mind in that period of time, here's one you can always use. And the question I encourage you to use is to ask the pharmacist, is there anything I should know about this medication? And that then should lead them for the first thing that pops into their mind that they learned in those 7 to 8 years of pharmacy school about that medication to be able to share with you. Sometimes it may be that they need to go look it up because, unfortunately, or fortunately, I guess actually, is new medications are coming on the market all the time. And, we do keep up, but sometimes something comes on the market and we're not familiar with it. So they might have to go look that up to give you some of that information. So ask your specific questions that you have about it. If nothing comes to mind, say, is there anything I should ask or anything I should know about this specific medication? That's a great way to start a conversation and to become knowledgeable about the new prescriptions. Anything else out there? We pretty much covered it up, Cynthia and Kelsey.
I think we've covered them.
Great. Well, Laura, I'll throw it back over to you then.
All right. Thank you so much, Ruth. That was terrific. I learned something every time I hear one of these GenerationRx presentations. My favorite will always be disposing of the pills in a Ziploc with some water and coffee grounds or kitty litter. Phenomenal. And another thing that I learned from Chelsea Peckney, I think probably the first time I met her, we were at a big opioids meeting and I was sitting at her table and she said that never throw away your prescription bottles with your name and the prescription name, peel the labels off, because people will go through your trash and they will find it. And if it's something desirable, they might break into your house. And I was like, who does that? Apparently people do that. So, and I have an elderly dog who takes a couple different kinds of pain pills. So I peel the labels off hers because they don't know if it says canine, but they don't care.
No.
Yeah.
No, and that's a really great point to bring up, Laura, is that it's not just your private health information. It's also that it can put you at risk for people who, unfortunately have developed a need to continue to misuse the medications and are going to go to crazy lengths to get access to them.
Yes. So I really appreciate that. I appreciate everybody joining us today. I hope you learned something. Please take that post survey. I put the link in there again. I will be emailing you maybe next week, possibly the week after that. I have recorded this video. We have transcripts. Once I have edited those transcripts, I'm posting it on the Ohio Agribility YouTube channel. I'm going to send the link out. Once that, see, it just said Ohio Durability. Did you guys see that in the transcript? There it is again, Ohio Durability this time, but I'm going to put it on our website and then I will send that out. Ruth is going to share some resources with me, and I'll have the links from this one, GenerationRx, etc. It will go in an email to you. In the chat box, I put the link for the Agribility Caregiver Support Network page. We have recordings of the caregiver burnout presentation, we had 2 different respite presentations in February. Those are recorded. They're really good stuff. I have a lot of resources on that site, so please go look. Post survey link is in the chat box. And thank you everybody for joining us today. I hope the weather looks better. I think it's still raining here in Central Ohio, but thank you for joining us. We really appreciate it, and have a great June and summer. Thanks.